My name is Saunteel Jenkins. I'm the Chief Executive Officer for the Heat and Warmth Fund, also known as THAW. THAW was founded in 1985 here in Michigan in response to what was an energy crisis at that time. We were founded here in Detroit, but we serve the entire state of Michigan. We provide assistance with gas, electricity, heat, and heat in the form of natural gas, wood, propane, and something that might be unique to Michigan is cherry pits. We will assist people with cherry pits that they use just like wood pellets to heat their homes, which I think is pretty cool. THAW also provides water assistance. I think that COVID, just like in Michigan, like everywhere, it exacerbated the need. And it highlighted a need that in some areas, maybe people weren't quite paying attention to. Rural areas are often, their needs are as great as major metropolitan and urban areas, but they don't have the same access to services. You know, one thing we often hear in Detroit is a lack of access because of transportation, but in rural communities, agencies may be 50, 60 miles away from them, right? So COVID really drove that home and the need for us to find innovative ways to serve people wherever they are. The internet became a really big issue for THAW. For the first time we closed our doors, first time ever since 1985, COVID caused us to close our doors. We were not seeing customers prior from October to March, October 2019 to March of 2020, THAW had about 1,500 walk-in customers. Didn't have appointments, they just walked through our doors because they needed help. And then we had to shut all of that down. So we had to be flexible like everybody else. We became very virtual, very tech savvy. We started providing virtual appointments. We created again, online chat. We were doing like virtual doctor's visits where we could literally walk our customers through appointments. Utilizing, with their permission, we could get access to their computer screen, keeping in mind that many of our customers have issues reading. So we could get access to their computer screen and say, put your name here, right? And point to the screen. Those kinds of things helped many of our customers, but our rural customers who did not have access to Wi-Fi were left out, literally left out in the cold in some instances. So COVID drove that home. The other thing that was really prevalent during COVID was the number of people reaching out for help and assistance who had never sought help before. We started a frontline energy program for people for bus drivers, for security officers in the hospitals, people who were frontline workers and heroes that weren't necessarily in the spotlight. People were finding it was a blow to their income. Their incomes were decreasing. They lost one or two incomes in many homes, and their energy use was increasing, right? So their gas bill went up, their electricity bill went up, their water bills went up, and they had less income to address. IHEAL, the Frontline Workers Program, which we talked about. We also have a program where we're working directly with a local hospital, Henry Ford Hospital, with their maternity child health program. And we are providing assistance. We are in partnership with the Kellogg Foundation and Henry Ford Hospital, the goal is to reduce infant mortality in the city of Detroit, preterm births, and low birth weights for babies in Detroit. Research has shown that one of the consistent stressors that lead to infant mortality is financial stress. And when you stabilize for every other risk factor, the one that remains steady is financial stress. So we, through this program, this pilot, we're providing energy assistance to high-risk mothers through the first year of the child's life. And we're tracking the mother, we're tracking the child to see if there's a difference in preterm birth, birth weight, and infant mortality by providing something that we see as simple as energy assistance. But we know that heat, electricity, water all make a huge difference in the quality of life and the health of the mother and the child. So that's another example. There were many programs. LIHEAP was certainly instrumental in serving the needs of many of the families who found themselves in a crisis during COVID. The LIHEAP dollars were expanded here in Michigan, and I think across the country, LIHEAP dollars were expanded. In addition to LIHEAP, here in Michigan, we have MEEP, which is the Michigan Energy Assistance Program. And the MEEP program assists with not only crisis, but we have what we call affordable payment plans. And the affordable payment plans allow families to be on a plan with a subsidized lower payment for up to 24 months. As long as they are paying their bill every month on time, then we would also pay a portion. So they'd have a flat rate for, as an example, their flat rate could be $95. So if their bill is $200, they pay $95, thaw pays $105 or more, because their rate for the 24 months doesn't change. So if their bill, and now bills are probably closer to $300 or $400 because the cost of energy has gone up. So even if their bill is $300, then we'll pay $205 and they pay the $95. So, and that's for 24 months. And during that 24-month period, we also provide other wraparound services, including energy efficiency services. We provide referrals for employment, for health or mental health, whatever the other needs are in the household. And the goal is at the end of 24 months, this family, this household is more stable and they're closer to self-sufficiency. I think that's the other piece that people don't often think about is medical conditions, and people who have persistent medical conditions that require that they have access to heat or electricity, right? To plug up their medical equipment, to keep their insulin refrigerated. So yes, we found many of those types of families. We actually, one family that we highlighted was a mother who actually was, she was a cancer patient who had a special needs son who had also been diagnosed with cancer. And they were both in their home, and neither of them could work outside of the home, right? The mom had been able to still work part-time while she was going through treatment. But of course, with the advent of COVID, it was risky for anybody to be out in public, certainly someone being treated for cancer. So that income went away, and we were able to assist her and her son, and we got them on what we call our iHeal program, which is an energy assistance. It's improving health through Energy Assistance Program. That's what IHEAL stands for. And they are also able to be on this program for up to 24 months, but the income guidelines are slightly higher than the 150% of the federal poverty level, which is the income guideline for LIHEAP. One of the things that, frankly, organizations like THAW and many organizations that are receiving and advocating for LIHEAP need to talk about more, right? What we're doing is preventing or alleviating a crisis. We are not addressing the core issue or the root of what's causing that issue. You know, that's one of the reasons that, and another program, just to talk about it, is our energy efficiency assistance, right? And the reason that that piece is so important, and weatherization, is because that does at least provide some kind of a longer term solution, right? You're reducing the cost of their utilities long-term by making their homes more energy efficient. But those wraparound services, the referral services to education, to job training, for health or mental health services are the connections that help create long-term change. Without those, they'll, you know, often people are back. Those partnerships are huge. I'll tell you, when I started at THAW, I started November 2014. My first LIHEAP Action Day was 2015. And the first time I remember going to in and out of offices on Capitol Hill. Some were familiar with LIHEAP, some were not, but we were spending a lot of time educating our policymakers on what LIHEAP is, the importance of LIHEAP. And I'll compare that to this year. It's gotten better each year, but this year, there were maybe one or two offices out of 13 where we had to actually say, this is what LIHEAP is, this is the importance of LIHEAP. So the work that NUAC has done, the work that Katrina has done, the work that organizations around the country have done to advocate for LIHEAP, to educate others for LIHEAP, even LIHEAP.org. I think the collective work has made such a difference, and we see the results in the funding levels. When I first came to THAW, 9 years ago now, and there have been many stories over the years, but this gentleman, when I walked in, I was coming in, he was already here waiting for help. I walked in, he was sitting in the lobby with tears in his eyes. And he recognized me and spoke to me and thanked me for my service. Before I came to THAW, I was at Detroit City Council. I started talking to him. He was a police officer. He had been shot 13 times on duty. I remember when he started talking to me, I actually remembered the story, but he had been in the hospital and had 6 or 7 surgeries. He'd been in the hospital for over a year recovering. While he was in the hospital, his wife was diagnosed with cancer and died. They had 3 daughters. He had a utility bill, a combined bill that was over $13,000. And he was saying, nobody can help. At the time, we were still a LIHEAP recipient. It hadn't quite changed yet in the state where DHHS was distributing all of it, but there were still caps, right? There are usually caps to LIHEAP. At the time, it might have been $3,000. This is going back to your last question. about the importance of different organizations and how building coalitions and everybody working together makes a huge difference. I was able to call DTE that day and get his power restored for him and his daughters. I worked with the Detroit Police Officers Association, which is the union, worked with DTE, worked with LIHEAP dollars and dollars that had been donated to THAW, which is the importance of nonprofit fundraising, right? Unrestricted dollars, so you can do this kind of thing. And between all of those organizations, we were able to get this man who had served his community and almost lost his life doing it, and couldn't afford to pay his bills, I'm sure because of he wasn't working, but I can't imagine what his medical bills must have been between him and his wife. And we were able to restore services for him and his three daughters. And the daughters, each one of them wrote us a letter and drew pictures. And we used to have the pictures actually up on our walls. If I had known you were going to ask this question, I would have pulled out their pictures as well as pre-COVID when we had customers. And let me just circle back to him. We were able to restore his power. We got them on a payment plan where they had a lower payment, a subsidized payment each month. And we were able to help them get other services that were needed in that household. So that's, I think, one of the stories that sticks with me the most because he was a police officer. And while he was going through his tragedy, he had to endure another tragedy and worry about paying his bills. There was another woman who was 92 years old, and this was actually, we were, a reporter from a local news station sent us a message on Facebook because a social worker reached out to, it's our, the name of the reporter, you know, every news station has like the rescue mission, the troubleshooters, and this was Help Me Hank is the name of it. And this woman was 92. She was living in her house with no heat. She had been without heat for 2 years. She had an electric heater. She slept in her living room in a lazy board chair for 2 years next to this heater. And now her electricity was being turned off, of course, because her electric bill was so high. So they sent us a message on Facebook. We reached out. We got connected with the senior. We went out to her home. We were able to not only get her electric bill paid for, but it turns out she didn't have heat because her basement flooded. When her basement flooded, you know, her furnace was damaged. She had at the time some kind of like home repair warranty, but they wouldn't repair the furnace until she took care of the flooding issue. The flooding issue wasn't covered by any programs. Again, with the help of DTE, THAW, DHHS, we were able to get the flooding issue. The Detroit Water Department came out. We were able to get her flooding issue resolved, replace her furnace, get her electricity turned on. And I remember being at her house and she said, we went there after it was turned on. And she thanked us and said she forgot what it felt like to sleep in her own bed at 92 years old, and how grateful she was to us because she was able to sleep in her own bed. She had been washing up like on her stove. Fortunately, she had an electric stove. She had been heating water on her stove for 2 years and washing up in her kitchen. Her story ended up on the news. She had a niece that she had lost touch with. She was the only one still living in her family. And her niece had assumed that she passed away. The niece saw it on the news, got in touch with her. I mean, there were all kinds of great things that came out of that one story. Family reunited, this 92-year-old who could stay in her home, stay warm. Yeah, it was a great outcome. I would add the future of both LIHEAP and the Heat and Warmth Fund are essential to vulnerable families across the state of Michigan, but all of the country. And the need, unfortunately, is just growing, whether it's new families or simply the increased cost of utilities. LIHEAP is a life-saving critical program that is needed across this country and in Michigan. And THAW will be here helping families as long as we can. And we urge people to go out and advocate and support the funding and continued funding of LIHEAP. I think you could probably sense some of my passion when I talk about this, but I'm so passionate about it because actually my family, we were recipients of LIHEAP and energy assistance. When I was in high school, my father was a mailman. He slipped on ice during the winter, broke his leg, couldn't work, and was receiving disability. And we were one of those families that we always talk about. You're one paycheck away from homelessness, right? Or from crisis. And when my father was on disability, we received LIHEAP. I know what it feels like to live in a house without heat or electricity, actually, because I've lived in one. So I do this work with great gratitude and passion. And I think that I hope that I'm an example of how it can make a difference for people.